up everyone? Today we are going to talk about common running injuries such as shin splints, IT band syndrome, plantar fasciitis, and runner's knee. Understanding the causes behind these injuries is going to be essential for effective prevention and management so we can continue doing what we love. I've spent years pushing the limits of my training in CrossFit, marathons, ultramarathons, high rocks, and strength training. While I love running, it can be tough on our bodies, especially without proper mechanics. Whether you're a seasoned runner or maybe you're just starting out, injuries are a runner's worst nightmare. And because of that, I'm super passionate about dialing in the training methods that help all of us greatly reduce the likelihood of injuries. Running injuries are all too common, and I've personally dealt with my fair share over the years. So let's break down the most common injuries and what we can do to prevent them so we can keep on running. The first thing we're going to start with is shin splints. Shin splints typically manifest with a sharp pain along the shin bone, typically caused by inflammation of the muscles and tendons around the tibia. This condition is common in those who love pushing their running limits. Maybe we added a little too much volume too quickly, or we aren't taking enough rest days, allowing our body to recover. To prevent shin splints, focus on strengthening the muscles supporting the shins. Effective exercises include tibialis raises. These can be done seated with a light kettlebell on the foot as you raise the top of the foot in the direction of your shin. They can also be done leaning at an angle with your back against a wall. So driving our heels into the ground and raising your toes as high as you're able to. And some of the other exercises that just help prevent the likelihood of shin splints are calf raises, maybe with a softball between those heels, single leg wall leaning calf raises, slow and controlled, the soleus farmer carry, tibialis anterior raises with a band, maybe some pogo hops, and band assisted ankle dorsiflexion. What these exercises have in common is they increase the strength and endurance of the anterior tibialis and the soleus muscles, which support the shins and are often the muscle groups that tend to get neglected in training. Then there's runner's knee. Runner's knee is characterized by persistent pain around or behind the kneecap, usually caused by overused muscle imbalances. This can make everyday activities like going up and down the stairs tricky and painful, and the root cause often lies in weak hip muscles, which affect the stability and alignment of the entire lower body kinetic chain. When the hip muscles are weak, it can lead to compensations and increased stress on your knee joint. So to prevent runner's knee, the goal is to strengthen the hip muscles, reducing stress on the knee. One of my favorite drills is the single leg power press, working the inside leg. This drill forces the outside of the glute to fire in order to prevent being internally rotated by the band. Some of our other favorite exercises or drills include goblet hold heel taps, forward, side, and reverse heel taps, hip hikes, the Captain Morgan exercise, bridge with hip flexor march, single leg Romanian deadlifts with the row, lateral bounding with a monster band, forward, backward, side to side, banded toe step backs, SI joint abductions and clamshells, and single leg kettlebell passes side to side in that Romanian deadlift position. These exercises target the hip muscles and enhance stability and strengthen the lower body, reducing the likelihood of runner's knee while creating strong, stable hips. These also help close the gap between our dominant side and our weaker side, since most of these are single leg exercises. Now, let's talk about IT band syndrome. We've all heard of IT band syndrome. IT band syndrome involves tightness or pain on the outside of the knee, often caused by the iliotibial band, a thick band of tissue rubbing against the bone. Strengthening the hip, particularly the gluteus medius, is going to be crucial for reducing the likelihood of experiencing symptoms when it comes to IT band syndrome. A common misconception is that you need to stretch or foam roll the IT band, but this doesn't resolve the issue always. It can help, but it doesn't necessarily resolve the issue. Instead of just foam rolling and stretching, try focusing on strengthening your hips. Improving hip stability will reduce tension on the IT band. Effective exercises include toe step backs, goblet hold step backs, the Captain Morgan exercise, standing clamshells, a modified side plank with banded abduction, single leg Pallof presses, and eccentric quad strengthening exercises such as slow controlled reverse Nordics, single leg sit to stands, and the eccentric step downs. These exercises are going to target the hip muscles and help alleviate IT band syndrome by improving your hip stability and reducing tension on the IT band. It's likely also going to help prevent runner's knee because a lot of those are similar exercises, and hopefully thus far you can see that strong hips can prevent a lot of running injuries. So we want to make sure we have strength training in our routine because it's only going to help us feel stronger as runners. Now, on to plantar fasciitis. Plantar fasciitis presents as a stabbing pain in the heel, especially first thing in the morning. It's caused by inflammation of the plantar fascia, the tissue connecting the heel bone to your toes. Proper foot mechanics and strengthening the muscles of the foot and lower leg are key to managing this injury. To prevent plantar fasciitis, focus on exercises that are going to improve your foot strength and the mechanics. This could include balancing on one foot barefoot, single leg iso holds on a plate with your heel elevated, 1 down, 2 up calf raises, soleus farmer carries, seated calf raises with weight, maybe foam rolling the calf, and including some banded calf raises with the band around your heels and the laces. These exercises are going to help strengthen the muscles supporting your plantar fascia and improve your foot mechanics and hopefully reduce the risk of plantar fasciitis. Running is fantastic for cardiovascular fitness and mental clarity, but it's highly repetitive, which can lead to imbalances and overuse injuries. During a run, your quads, your hamstrings, your calves, they're doing most of the work while your core is stabilizing you and your arms are swinging for momentum. However, there's many other muscles that aren't getting as much attention. Strength training ensures that all these muscles are kept in balance. By targeting those neglected muscle groups and strengthening the opposing muscles, you can balance out that repetitive motion of running. For instance, strengthening your glutes can reduce the load on your knees, and working on your hip flexors can make your stride more efficient. Additionally, strength training fortifies your tendons, your ligaments, and preserves bone density, the connective tissues that hold your body together and can absorb the impact when you run. When these structures are stronger, your body can better handle the stress of running, making you less vulnerable to these injuries. A couple of other tips for keeping your running strong and feeling good during your runs. First, I can't stress enough the importance of warm-ups. It's tempting to just lace up your shoes and just start running, but taking even just a few minutes to warm up and cool down can make the world of a difference, 1, in how you feel during your run, and 2, how you're recovering. Start with some light cardio, just something to get your blood flowing, then into some dynamic stretches like leg swings side to side, forward, backwards. This is gonna give you a chance to see how your body is feeling and if you're feeling tight or sore. Cooling down after your run is just as important as that warm up. It's gonna help your heart rate gradually return to normal, preventing blood from pooling in your legs, and a slower cool down reduces muscle soreness by slowly lowering your heart rate and continuing to keep your blood moving. Next, recovery matters. We all love that runner's high, but pushing yourself to the limit every single day is just setting your body up for disaster. Your body needs time to rest and repair itself after a hard workout. That means it's okay to take rest days. I'm gonna say that again. It's okay to take rest days. Rest days are time that you should use to get enough sleep and fuel your body. That way you can recover and feel stronger on your next run. We also love the slow and steady approach, and it always results in more progress and less injuries. Trying to do too much too soon is a common mistake that can lead to injuries. Gradually increasing your mileage and intensity over time is the key to real improvement. Listen to your body. Don't be afraid to take a step back if you need to. Trust me, when I say your body is pretty smart, and it will give you warning signs if you're pushing too hard. If you're having persistent aches and pains of fatigue, don't ignore them. This is your body giving you signs that you may need to take a break or just change up your training a little bit. It's always better to take a few days off now than to be sidelined for weeks or even months with an injury. Hopefully throughout this entire video, you have learned that strength training doesn't detract from your running. It enhances your resilience as a runner. It's essentially an investment in a more enjoyable and stress-free running experience in the future. If you want to learn more about how to mix running and strength training, visit our website, IBEX Training. We've got programs, resources, and a whole community of runners, hybrid athletes, and CrossFitters who are passionate about staying strong and injury-free. If you have anything else you want to see in the next video, make sure to drop that in the comments, smash that like button, and don't forget to hit subscribe. We look forward to catching you guys in the next video.
When I'm walking the streets, I know you're feeling the heat.